Ron Elepaño. Yan. At ang ating pag-uusapan po ay medyo nosebleed yung hypochondriasis.
Tinatawag kami ng professor. So walang upuan yun hanggat nakakasagot ka. Halos umiihi ka na. Sasabihin, may sakit yan, hypochondriasis.
Ano ba yun?
Yun ang gusto natin tanongin dito.
Well, ngayon kasi, hypochondriasis is an old term, no? Ang hypochondriasis, ibig sabihin nito, lagi kang may nararamdaman, feeling mo, lahat ng nararamdaman mo, related to an illness. Marami kang mga sakit-sakit. Sakit ng ulo, sa likod.
Ito ba yung tinatawag
parang
nila?
feeling mo bloated ka, feeling mo nasusuka ka, pero feeling lang. Wala talagang nakikita pag in-examine siya ng doktor, hirap ka huminga, wala nakikitang reason kung bakit ganun yung nararamdaman.
Ito ba yung mga taong tinatawag na meron silang health phobia? Tama ba? Iba pa
Actually,
yun?
the health phobia is different eh.
Okay.
Kasi ito, gusto nilang pumupunta sa doktor, no? Ang health phobia, ayaw nila eh. They're afraid that they might be sick, no? So ito, kadalasan, sila yung nagiging problems ng mga doctors, mga primary care physicians. Kasi pag pumupunta sila sa doktor, wala naman sila nakikitang reason kung bakit sila nakakaramdam na itong mga symptoms na to. No? So, magiging health issue siya because these patients, i-insist nila that there's something wrong with them, pero wala naman talaga.
So psychological, Doc?
It's primarily psychological. Unfortunately, hindi naman sila pupunta muna sa psychiatrist. No, they go to a primary physician, no? So importante ho dito na maintindihan ng mga primary physician na may mga ganitong klaseng sakit, no? And kasi sila yung nakakakilala sa mga pasyente, sila yung tinatawag nilang family doctor, no? So they're closest to the patient. Kailangan ma-assure nila o ma-direct nila yung pasyente sa isang psychiatrist para ma-treat sila appropriately.
And not necessarily yung hypochondriasis, di ba, Doc, na yung may sakit, may ganyan. Kasi may mga situation din na feeling nila lahat ng mga binabasa nila ay about them.
Actually, totoo yan, no? Actually, in medical school, no, yung mga medical students during their first and second year, medical years in school, they actually experience a transient form of hypochondriasis. No? Ngayon ho kasi hindi na natin ginagamit yun. Ang tinatawag na natin somatic symptom disorder. No? Ibig sabihin ho nito, marami siyang nararamdaman, pero hindi niya na-identify it as a sakit. But they feel na merong sakit sila. No? Di lang nila alam kung ano exactly.
Lalo pag ayaw pumasok.
Yun nga eh.
Actually, yung tanong ko, yung any age ba nagkakaroon nitong hypochondriasis?
Yes,
Kasi may mga
actually,
bata,
for
diba?
children, di ba, sometimes nagkakaroon sila ng tinatawag na death anxiety. Once they come to realize na, dati kasi understanding ng bata that death is temporary. Depends on their age eh. Once that they realize that death is actually permanent, nagkakaroon sila ng death anxiety. So, pwede rin sila magkaroon ng hypochondriasis at I can get sick, ganito rin. But it also is transient, no? It becomes problematic when it's persistent more than 6 months, no? By criteria. Laging gano'n na lang yung problema mo, hindi ka na maka-function because you keep insisting on going to the doctor because you're feeling something.
Ako nung high school ako, Doc, lagi ako may sakit pag may finals.
Oh, yun, diba? Usually. No?
Iba naman ata.
Hindi, yung feeling ko talaga na nilalagnat ako kahit gumagawa ko ng finals.
But actually, that is the basis naman ho talaga for hypochondriasis, no? Ibig sabihin dito na usually, ang reason bakit siya nagkakaganon, kasi meron kang unresolved conflict eh. Rather than accepting on your own that you have this problem, no, na parang ayaw mo, I'm not ready. Like for instance, for exam, I'm not ready to take the exam, kaya feeling mo magkakasakit ka. Rather than accepting on your own na hindi ka talaga ready, lumalabas siya on a physical plane.
Question ko, Doc, is, for example, there have been instances na may mga kilala ako nagkaka-fever. Pag na-check naman ng doktor, walang underlying cause. Ano ba to? Parang triggered by sa kakaisip na may fever ako, may sakit ako, biglang nagka-fever?
That's a very good question kasi this is what's very fascinating about this disease because it's primarily psychological, no? Although may mga studies sila that it's genetic, no? Hindi naman ganun kataas na percentage. At the most, by twin studies, 10-15%, no? 29 at the most, no? Overestimation yan. But they also found out that it is related to increasing levels of inflammatory chemicals in the body which can actually explain the presence of fever. Pwede ka talaga mag-fever, pwede ka talaga magkaroon ng sakit, no? Yung iba talaga lumalabas, kala mo may sakit, they actually go to a neurologist and mukha talaga silang, yung iba mukha silang na stroke, no? Because of this, no? So this is important for you to actually do your physical examination, history taking very properly.
At saka apparently pala, Doc, hindi lang pala to sa tao lang nangyayari. Kasi yung aso namin na-diagnose siya ng
Hypo?
hysterical pregnancy. Kasi gusto niya maging pregnant. Tapos nag-lactate siya and everything. Pero hindi, lumakit siya niya, pero hindi siya pregnant.
We also see that in humans, no? Yung,
really?
Hysterical
tinatawag natin,
pregnancy.
Hysterical pregnancy or pseudocyesis, no?
Interesting.
Do the cosmetic surgery addicts
fall under this diagnosis?
Actually, they have a different diagnosis called body dysmorphic disorder. Ang somatic symptom disorder is various forms of complaints. Hindi siya limited to the head, meron niyang GI symptoms, meron niyang cardiac symptoms, may genitourinary yan, no? Ang body dysmorphic is specifically a certain look that they're trying, aesthetics talaga yung hinahabol nila, no? So, but it falls under a similar blanket category of somatoform disorders.
are there instances that they do overlap?
Actually, ang criteria kasi says that somatic symptom disorder has to have various symptoms, hindi limited to aesthetics. So it's actually a completely different diagnosis, but they fall under a certain category. Yeah.
Doc, yung may mga hypochondriasis also suffer from depression, di ba yung mga ganun?
Yes.
So is it the same treatment as OCD, yung obsessive-compulsive disorder?
That's a good question, no? Kasi these patients or people who have somatic symptom disorder, they have a comorbid psychiatric condition as high as 80%. So if you diagnose that during the course of your examination, evaluation, treatment will dictate na kung ano yung appropriate secondary diagnosis. So kung may OCD sila, you treat it the same way you treat an OCD patient. It actually improves the treatment, no? Pero kung pure form sila na somatic symptom disorder, walang depression, walang anxiety, ang ultimate treatment talaga dito is psychotherapy. Walang gamot na usually you can give compared to if they have depression. So prognosis-wise, kung meron silang diagnosable condition, ibig sabihin, depression, anxiety, OCD, if you treat that, yung success rate of them recovering from this problem is better.
For this specific disorder, Doc, if you're not able to address right away, ano yung pinaka-worst na mangyayari?
Well, the worst case scenario here is actually yung financial burden. Financial burden for the patient, and then of course frustration from the attending physician. Kasi ito na yung feeling mo, lagi na lang siya nandiyan, araw-araw na lang, no? Nababurn out ka, na-frustrate ka. So it actually burdens not only the patient, but also the healthcare community. Naiinis na yung mga tao sa kanya. So, in effect, nagiging ineffective healthcare providers sila.
Pero, Doc, sige, how do you prevent it? Do you like keep yourself busy or?
Okay. Well, ideally is that for you to talk to somebody, no? About your problems, no? But ang usual advice nila, when you go to your general physicians, no? Dapat yung general physicians kasi meron silang basic mental health training, no? Which is something that we always advocate kasi nga konti lang kami, no? The very least that they can do is teach patients or people to manage stress properly. Stress reduction is actually very helpful. Usually kasi very stressful ang life natin, and sometimes we fail to see that we're stressed, and this actually manifests by virtue of somatic symptoms.
And I guess talagang it's very important na magkaroon ng early detection para nga makaiwas dun sa mga na-mention mo, Doc. Anyway, Doc, speaking of detection, ayan, kapag ba meron kaming gustong ipa-detect sa'yo or meron kaming gustong ipakonsult, saan ka namin pwedeng hanapin?
Yes, you can find me at Medical City at 689-8278.
Alright,
One quick and last question.
Sige po.
So, sa layman's term po, itong hypochondriasis, pagsisinungaling?
Actually, hindi. Surprisingly, hindi. Iba pa sila eh. Kasi, meron
convinced
silang
sila.
separate category called yung mga nagsisinungaling just to get out of what? Exams, court, or any legal problems, or sa work, the very least. Yun yung iba doon, malingerers yung tawag natin.
Malingerers.
So,
Social lang konti, malingerers.
malingerers sila. So, ang role namin ng psychiatrist is to identify if these are malingerers or there are different patients.
Kasi I think itong mga convinced talaga sila na may mga sakit
Meron
sila.
talaga silang problem. Nagiging secondary na lang yung benefits from seeing a doctor dahil may sakit sila. Kaya din, important for doctors to identify these patients kasi they also have a responsibility to whatever company the patient is actually to the company the patient is employed under.
Okay. Thank you so much, Dr. Ron Elepaño. Ang
Thank you
dami
very
natin
much.
natutunan about this sickness.